We will move on to approval of the April 19th, 2022 Board of Health meeting minutes. I'll entertain a motion to approve.
So moved.
Thank you. And a second.
We did notice on, it was the fourth from the last page, there was just a sentence which basically was copied right below it with the new title of discussion and approval home. Surrounding counties that have moved to medium level. And so I would assume that either we're already there and just not seeing the numbers yet because there's so many home tests that are being done. But we definitely are seeing, more cases, and we want to just continue to remind people just to be careful and take precautions to keep themselves and others safe. Macon County is in high community transmission level, and that is the number that is used for healthcare facilities, for decisions, and for certain measures that they have to take. So a lot of the state is in high. And the numbers as of May 15th, number of cases, there is 62 point. Our case rate was 192.29 per 100,000, and the aim for that historically has been 50. So definitely seeing numbers up again.
Could you repeat that? 192?
192.29. And those numbers do update. Yes, pretty regularly, and those are the ones that we're pulling from the CDC community tracker, CDC data tracker, that you can look on there for the entire nation and look specific to states and then counties of where we are and basically the recommendations or mitigations that we should follow based on where we're at. For hospitalizations through May 14th, there was a decrease of 12.5%, but for number of beds, there was a 0.8 increase, and for number of ICU beds, there was a 4.4 increase. Home tests are not all being counted in that, so we do assume there's more positive out there, so just, reminders of being safe. And then I did send you an email just highlighting that there were going to be some changes with the Surge Center, which is that contact tracing center that was developed by the state. Those changes will be effective June 1st. Case interviews will no longer be done by the Surge Center. Cases will be routed to the health department. However, we will not be responsible for calling all of them. Every case will get an automated text message. The 312 number, if you recall that, we've talked about that a lot, that is going away in the capacity that it has existed to this point. Residents, when they receive a text, will have prompts they can follow to be directed to guidance, but there will not be a state level interview or human answering those calls. So that significantly changes, what contact tracing has looked like for quite some time now. And then there is information on the website that people will be directed to. People can still call us here locally if they have questions or need assistance. For anyone that may not understand what they're finding on the internet or may have questions, or if they don't have internet access or cannot, read what is there, we're still going to be a resource for them here locally. We are removing that 312 phone number from all of our communications to ensure that there will hopefully not be any confusion. We also will be putting more communication out to the public so they know this change is coming, because it is very significant when people have been expecting contact tracing to happen and now this change is going to occur. So we wanted to make sure you all knew as our board, in case you heard anything or got any questions. As always, feel free to forward people to us and we will help them work through what's going on. If there is an undeliverable text, so that would be the people that before, if their text was not successful that came from the Surge Center, they could talk to us here at the local health department. That will continue. The expectation from the state is that based on the bandwidth of the health department to respond to those phone calls, that is how we will handle them. We continue to have the one full-time staff person that is handling those calls and assisting with outbreaks. We are having a steady number of outbreaks where we'll close some out and then we're getting more. So definitely we're happy we have her in that role, because it is always an expectation of health departments for any communicable disease for which we are responsible, that we are to handle those and help guide people and then handle outbreaks. So that remains the same for COVID-19. And let's see if there's anything else. There are still unanswered questions that local health departments have about this change with the Surge Center, and we've been told to expect additional communication from the state. But we will put information out to our public, even if we don't have something formal from the state to put out, just to ensure that our community knows what's going on and knows those changes will occur. So that is all I have for that COVID report, and there was no other board education for the month. So if anyone has questions for me, I'm happy to answer those.
Randy, I didn't get that email. If you could.
Okay.
Send it up.
Yeah.
No questions? We'll move on to presentation and acceptance of financial report. Julie?
Okay, the report is in your packet and it is through the end of April. We were 42% into the fiscal year. Total fund balance was at $7.5 million. Total revenue at $3.7 million, which is 54.8% into budgeted revenue. And total expenditures at $2.7 million, which is at 39.8% of budgeted expenditures.
Bethany, are we trending good then? You're comfortable with?
Sherry?
I'm
Yeah.
sorry.
That's okay.
Yeah, Sherry.
Yeah, I mean, our expenditures are under, but I mean, timing is always a little off. We don't always have equal spending throughout the year. We're coming up on the end of a lot of our grants, so the spending will probably get a little heavier as we make sure we get everything in that we budgeted. Most of our grants are on the state fiscal year, so they end June 30th.
Okay. We have a motion to approve the financials.
So moved.
Thank you.
And you're the second.
Mark and Cole. Roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack,
Approved.
Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Cody Parks.
Yes.
Motion carried. Moving on to department expenditures, they are in your packet. I will entertain a motion to approve the department expenditures.
I'll make a motion for the expenditure.
Thank you. Questions? Roll call vote.
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jan Hack.
Yeah.
Candy Clevenger,
Yes.
Jeff Entler,
Yes.
Debbie Hill,
Yes.
Cody Parks.
Yes.
Okay, motion carried. Are there any grant applications for you? The department division reports are in your packet, and we have a presentation from Women, Infants, and Children Family Case Management.
Good evening, everyone. My name is Karen Shiplet, and I am the director for the WIC and the Family Case Management Division here at the Health Department. I'm a registered nurse, and I came to the Health Department in 1994. I began my career here as a family case manager and also was a nurse for immunization and well child. In 2000, I took over as HIV coordinator, and in 2005, I moved to this division to supervise these programs. So I'm going to share a little bit about what I do and what our team does. I like to start with WIC because it's like the umbrella. It's the biggest one. I have the largest caseload for this program. We're assigned 2,052 families to serve each month. We're meeting about half of that, and this is a program, Women, Infants, and Children. It's serving pregnant, breastfeeding, postpartum women, and children up to 5 years of age. We provide supplemental foods to them through a food package that's issued on a debit-like card that they can take to the store. Certainly provide nutrition education and assessment and referral. It's a wonderful program, and it does help families as well that have those expensive medical formulas prescribed to them. We also provide and promote at all times breastfeeding and offer an additional program under the WIC bonnet called the Breastfeeding Peer Program. This is a super successful program that links women who are peers themselves. In other words, these aren't nurses or RDs or trained individuals. We train another woman who's at the age level and is currently breastfeeding or recently breastfed in the past 5 years to support women who are interested in learning about breastfeeding and sustaining breastfeeding. They have texting ability, they work outside the normal office hours, and it's just been a super exciting way for women who want to sustain a breastfeeding relationship to do so. Once they get funneled into the WIC program, through our assessments, we're able to also offer them other programs that might be beneficial. And the next largest program we supervise is family case management, the one that I started in a million years ago. And family case management is an income-based program that serves pregnant women and children up to 1 year of age. They provide health education, accurate health education to the families that they're working with, and sort of what I call provide anticipatory guidance. These are families who may not understand what's going to take place during their pregnancy or what the normal development for their baby will be, and they work with them to understand what those needs are. All of these programs have the overall goal of reducing infant mortality, and the number one way to do that is ensuring from the moment we meet with them that they're linked with a medical provider. So that's the most important thing that we also do for them. That caseload right now is 720. We're probably serving about 400. So we definitely have openings if people are interested in that program. The next program I supervise is high-risk infant follow-up. This is where a registered nurse meets with families who've been identified at the hospital level as being born with some adverse pregnancy outcome. That's kind of complicated, but the bottom line is it could be something as basic as prematurity or substance abuse in utero, or it could be things like heart anomalies, other birth defects. And so we follow those kiddos if the family volunteers to do so for up to 2 years. And this nurse will provide them support and understanding of how to care for their high-risk baby and also provide developmental screenings. It can be so important. I was the mother of a 29-week born child, and I can tell you I didn't understand why other babies were so much farther along than he was. And so developmental assessment and helping the families understand how to adjust for prematurity is one of the basic and most wonderful things that that nurse can provide to help the families bond in a better way with their kiddos. We can also identify children through our risk assessments in our other programs as being high risk. Maybe they're diagnosed with something after they're born, and they can then be referred into that program. We're currently serving about 85 families. We're assigned 120. That one is not income-based because obviously anyone can deliver a baby that may be high risk. It is voluntary, though, to participate. We have another program I supervise called Better Birth Outcomes, and this is a program that serves high-risk pregnant women. Our nurses follow them for the entire pregnancy and then works with them through 6 weeks postpartum. These are mothers who are identified as having some kind of a concern that they might deliver their baby less than 5 pounds, 8 ounces. Research indicates if you can get them above 5 pounds, 8 ounces at birth, they'll have a better outcome to their life and development. So we work with moms who might be identified with high blood pressure, diabetes, mental health concerns, women who may have had a negative birth outcome in the past, lost a baby to miscarriage or stillbirth. We work with moms who have low literacy levels, maybe they're pregnant with twins, triplets, and they meet with them monthly intensively to promote prenatal education, to help them have the best possible outcome for that pregnancy and deliver the healthiest baby possible. They also can provide some supportive needs for the mom, such as a bus pass to make sure if she has trouble with transportation, she's able to get to her physician appointments, because that's the most important thing for her to have a positive birth outcome, is to be in constant care with her physician. That caseload is also about 120, and we're only in the 60s range for that one. So we have lots of openings. The final program that I supervise is iGrow Coordinated Intake, and it's kind of complicated. iGrow is a collaborative process that provides families with a single point of entry for home visiting needs. And the home visiting, again, is meant to help promote bonding and support the family's ability to grow together and feel good and relate to their child in the most positive way. It's serving pregnant women and children 0 to 5 years of age. And the coordinated intake worker assesses the family and determines with that assessment what's the best fit for them of community home visiting programs that we have in Macon County. So I would tell you, I think it's a very successful thing because it has allowed us to be more collaborative with all of the agencies that serve our target population outside the health department. It's not just based here and limited to health department only programming. So that is the content of what I supervise. And do you have any questions?
How do you find out about those programs?
You can find out about them on our website. We have a wonderful, long-standing history with the WIC program in this community. School nurses are aware. We network with the prenatal clinics, New Life Pregnancy. We network with the high schools. We have a great collaborative relationship for the most part with DCFS even, and we receive many referrals from them for families that are not yet in dire need, but could be for support for their family. We also have, in the past, a pretty good relationship with the public aid system. Things have changed a bit with that in COVID. But we have a lot of community awareness, and word of mouth, most of all, seems to bring us our population. But we are pursuing outreach on the regular. We do have access to a few prenatal clinics in the community, but that I would say is our biggest challenge right now, is keeping that access going and getting back into providers that sort of had to shut things down for us during COVID. Questions?
I would just say thanks for doing what you do with the WIC program, because everybody needs some help at some point in time. And I know from my own personal experience with a young family growing up that those little things don't seem like a lot, but they are. My kids went to the school program at Mueller Park and did that. And that really made a difference in getting them on the right path going forward into school and stuff. So, but I appreciate that program is still in existence and doing what they do, because there's people out there. I mean, look at right now, we're in the middle of a formula crisis of all things. Who would ever thought that was going to be a problem? And so everybody needs some help at one time or another. So I appreciate the work that you're doing.
Thank you so much for the compliment. It's definitely a very committed team that we have here. All of my staff are super dedicated, and I do think several of us have experienced the WIC program ourselves personally. I grew up very middle class, but ended up a single parent at a point in my life and utilized WIC, and I cannot say enough about the program. So thank you very much for acknowledging it. Any other questions?
I've got a couple.
Sure.
I'd like to echo what Mark said too. Very impressive department, group of people, and programs are just phenomenal. How many people are in your organization?
I supervise 17 staff right now.
17, okay.
Maybe 18. One of them's on maternity leave.
And as a board, how can we better help you? Anything we can help with, or?
I appreciate the
Any
request. I
suggestions?
think just support, public support when you're out and about, to share your positive thinking of what we do here in the health department. And now that you're aware of how much we're doing through our presentations, we would just covet your public support so much.
And again, some of your bigger challenges is transitioning from the COVID environment back to.
Yes, there are providers that have changed hands. There are staff who have left, of course. People that we were very collaborative with in the past, like at the public aid office, that's all changed. And it affects our ability to get our awareness of what we can do and how we can support clients that are being served in the various agencies in the community. So the more that they could be aware, hey, call the health department. You don't know, you might qualify for some of this. And certainly if they're a young family or a parenting family, pregnant, we would love to have them.
Okay. Any other questions for Karen?
Thank you so much.
Karen.
Thank you, Karen.
Sorry for my
Thanks,
thick
Karen.
voice.
I had a couple things under division reports, if that's okay.
Okay, sure.
One quick thing, I just wanted to put in your mind, if you don't want to talk about it this month, we don't have to, but it'll be budget time again before we know it. So we wanted to just get an idea from you of how much notice or how early ahead of presenting the budget for approval that you all would prefer to receive that. I know we talked about that last year, and we do want to make sure to give you as much time as possible. Most likely, depending on the date that we are given by the county, most likely we will want our board to approve the budget at our August 16th meeting. And we usually have the finance committee, this board's finance committee meeting in advance of that day. So if you can kind of just start thinking about how many days or weeks in advance of that meeting that you would like to receive that first budget draft or package, so that you can start reviewing it, ask any questions that you have. You know, if you want to come in and meet and kind of talk through things, you know, individually or anything like that, that we can do to help you feel comfortable with voting on it at that August meeting, just let me know. And maybe by our June meeting next month, you could give me, you know, a definitive time period of what you're thinking, because it does take Sheree and the rest of our team quite some time to build all of those numbers, and then our accomplishments list and our challenges list, everything that goes into that package. So we do want to ensure we have time to get all that ready for you and give you time to review.
We need
What's a
to
reasonable-
see it no less than 60 days prior to a meeting where we're gonna take action on this. I will not be party to another budget being presented an hour before I have to make a decision on that. So, I mean, we need to see it at least 30 days out at minimum, but I would like to see a draft 60 days out. So we have questions, we can give you feedback. You can bring that back prior to that meeting. And then when we come to meet in August, then everybody's pretty much satisfied with where we're at. So we don't have any issues on that. But that's my opinion on it. We need time to get it.
What's a
processed.
reasonable expectation, Brandy? 60 days would be great too, but that seems like that's a long ways out, is that?
Well, I don't think that, as far as everything that goes into it, and then the numbers that Sheree would need from all of the months leading up to the creation of the budget, I don't know if 60 days would work, and she's certainly here, so she can speak to that in a moment, but that would be around June 16th, which is very, very soon. And she does work with all of our director level staff very closely to finalize those budgets, and then we also always give our lists of accomplishments, challenges, all of that all of the directors themselves write and submit. So I'm not sure if 60 is something we can do. Sheree, do you want to speak to that at all?
Let's negotiate.
When's the date that it's supposed to go to the
We don't have
county
that
board?
yet.
We don't know?
No,
No.
they haven't sent that out yet.
Well, I mean, I think it'd be about the same time every year, wouldn't it?
It's around the same time you get assigned a certain date, so that's why I said most
Well,
likely
okay,
we would
which
have to
month, I
present
guess, is
it.
what I'm asking.
This last time it was, I believe, like September 7th is when we had to present it to the finance committee the first time.
And you got pushed to the end and
Well, we actually presented it twice. So the first time we presented it was our assigned date, and then when this board approved it and then asked for it basically to be brought back to this board, then we went back, I think toward the end of September, maybe. I don't remember that date off the top of my head, but yeah, we actually took it back. So I mean, we could also request one of the later dates. We just try not to be difficult because I know the county does all of that, you know, strategically. So we can certainly ask for a further date out just to give the board, you know, enough time, and our CFO and directors enough time to get all of that ready.
Well, in fairness, you've got a little bigger, meatier budget, and then you've got an additional approval process. So I think that's fair to ask
Yeah.
that you're put at the end to give it more time.
Yeah, and I have no problem asking for that, and I can certainly bring, you know, the answer back to all of you and just let you know about it, but I don't see why that would be a problem at all.
Teresa, is July doable to have a draft to at least look at if we've got questions on things?
I mean, 30 days is doable, 60 days is absolutely
Well,
not
that's what I'm saying,
doable.
July, is that doable?
At this point, we are just getting our numbers in for what our next year grant contracts are gonna be. So before I have that, I really would just be totally guessing at a budget for next year. You have to keep in mind that this budget would start December 1st, so it still is a ways out. Like, I can prepare a budget at any point, but the closer I get to the date, the more accurate it's gonna be. So I mean, July is possible, yes, I think.
Could we have a stretch goal and say 6 weeks? Is that reasonable?
Well, if we're gonna look at in August, July is 30 days before. So I think we should at least have something to look at, because then we
I,
can,
I agree,
ask
30 days.
questions.
I'm
they got
thinking,
another 30 days to go back and make
I'm
adjustments
thinking
or.
another 2 weeks. I'm thinking 6 weeks. Just give us just a little bit more.
I'm just thinking about having it ready by July board meeting, so we got a chance to look at it. And then they got another 30 days to go back and adjust it or get answers or whatever. And then that way in August, when we meet, we've actually had the chance to look at it. And then we see it in its final state, and then we're good to go. That's what I'm looking at.
Good.
So is that a consensus just to have it to you for the July board meeting then?
I would say a draft, not a final budget, but at least a draft. That way it takes the pressure off of everybody,
Sounds
but
good.
at least then there could be conversations on this is where we're at and this is where we're still headed. There's some things here, because she said she might not have some numbers by the middle of July, but she might have them by the end of July. And then you get to August, and you say, okay, here's the gaps that I had in the previous draft proposal. Now I've got it fine tuned, because that's a lot to digest. There's a lot there to look at.
Yeah, we can definitely do that. And for the department division report, I think that I have Cherie scheduled for July so that she could do, you know, a little bit of, you know, the presentation about everything in her division, but then also highlight budget. So that'll really fit nicely. So we can definitely do that. And then if there's any other thoughts you have between now and then, please let us know. And I will also go ahead and email the county and ask them just to consider putting us toward the later group when they
I
do
would.
schedule all of those. I can reach out to them this week.
Doesn't cost nothing to ask.
Yeah, right, yeah. And then the only other thing that I had was just a reminder with your Board of Health emails. I think we only have a couple of you left that are, you know, needing to get that finalized. We have been sending everything to both your personal and your Board of Health email just to be safe, because I know some are struggling with that coming through. So hopefully we'll be to the point eventually where you can just let me know if you just want it to go to board, but I'll continue doing both, just so there's no gaps in any of you receiving anything in the meantime. And then just a reminder, we do send out private and confidential information in those, so just keep that in mind. And then we are going to provide something next month just about best practices with email and security and privacy and all of that. So Evan will provide that to all of you. And that's all I have. Thank you.
Okay, thank you. We have employee recognition, 1 May anniversary, Kim Saban, is that, I can pronounce it? Kim Saban Pritchett, 19 years, so we want to wish her a happy 19-year anniversary and thank her for her service. Old business, have discussion and approval of the home ed subcontract contract and business associate agreement.
So this is the one that we went over last month as a reminder, and Mike Baggett with the state's attorney's office did review it for us right away after that and did have some feedback. So I made the changes that he requested. And then also he had a couple outstanding questions about if our cyber liability insurance through the county was adequate to cover what was referenced in this agreement. And I did follow up with Carol Reed, who is the auditor, to confirm that. And she did confirm and send me something in writing that does show that it does meet that. And I did forward that to Mike, so that he has record of that. And then I'm not sure, Mike, if you've had a chance to review that, the master contract or whatever it was, I think that's the only outstanding. So if you can speak to that, that would, I think, determine whether or not they can vote.
I'm still not sure that I've seen the master contract. I've had various documents sent to me, but a lot of them are repetitive of things that have already been sent to me, and I don't believe I've seen a master contract, certainly nothing with the name master contractor that uses the language that is referenced in the subcontract as being defined and applicable in the master contract. So I'm still, a little bit in the dark on that. It's possible that what they're referring to, I've been given, but it doesn't say what they're saying it says, which gives me significant pause. Or it's possible that I just, for whatever reason, have not yet been sent the actual master contract or agreement. So still, very much unable to give an opinion as to whether that's something that the board should be agreeable to without seeing it. The subcontract itself doesn't really cause me a lot of concerns if the other party is willing to accept the changes that I've suggested. I would not expect the master contract to introduce elements that would be problematic, but without seeing it, I'm not willing to give a final sign off on it either.
Okay, so when, after your email, we reached directly to the agency to request the master contract, and that was what they sent us. So I'll just verify with them if the master contract is really called what I sent you. So what I'll do if the board is agreeable to it, Mike, if you are, is re-ask them if that is the master contract, but it's called, I can't remember what it was on the email, but I will get clarification and then of course send that on to Mike so that we can bring it back next month, hopefully with an opinion from Mike and that the other party is agreeable to his changes in the contract, and then hopefully we can vote then.
Do we need to make a motion to table this then formally?
I don't think so, do they?
You don't need to formally do it.
We got consensus, so.
Yeah, it's not final action, so by not addressing it, it can simply be brought back next month under old business.
Good with that then.
Okay, that's it. Discussion and action for Board of Health appointment.
Applications here, I want some.
I did pass one out to everyone. Yeah. You should have 4 that I passed out that I had access.
You gave us 3 and then I gave you 1, is that right?
Yes.
Yeah.
Well, my opinion on this is for filling a vacancy that we have from a resignation that we were just told out basically at last month's meeting. I'm gonna make a motion that we table moving forward on doing anything with this until next month, because we'll have 2 new board members here, and I would like to get their involvement, since it's going to involve putting another person in the chair for another year. So I think it's important that we give them due consideration, especially as new board members, to be involved in that process and be able to express their opinions, and also have the ability to vote and make a recommendation to the county board. I'm glad to see we've actually got several request forms. I've actually got 2 people that I've talked to too that haven't formally filled this document out, but have alluded to me they're very much interested. So I will get a copy of this now that I've seen this, because I hadn't seen it before, and pass that along, and then I'll send that back to the members of the nominating committee as well. But that would be a motion that I would make this time in regards to that vacancy.
I'd second that motion. I think that's an excellent direction to go with the process.
Mike, does that present any issues, since our bylaws say a vacancy should be filled immediately, and it hasn't, if it's not filled for 2 months, is that problematic if we have several nominees or anything?
No, your bylaws are not determinative here. The Board of Health doesn't have any authority to make recommendations to the county board, or it certainly doesn't have any binding authority with respect to who the chairman appoints. So the fact that the bylaws say that you need to do it in an expeditious manner, I don't think it presents a problem. The problem is created more in the line of the chairman may decide to make an appointment without waiting to hear from the Board of Health if the Board of Health is delaying its ultimate recommendation. Certainly, while there's no authority for the Board of Health to make those recommendations, there's nothing that prohibits it. And of course, historically, it has been the practice of the Board of Health to make such recommendations to allow the chairman and the county board to have some information about appointees or potential appointees before those appointments are made. But I think the only concern there isn't really with respect to the bylaws, it's with respect to whether the chairman wants to put a nominee forward sooner than the timeline outlined by the Board of Health at this point.
Well, I would say probably a good way to go with that, Mike, to keep the chairman and the county board in the loop, because that was one of the discussions at the board meeting last month, is we make them aware that we have several interested parties. And I would formally ask that somewhere between now and our meeting next month, that the nominating committee, who hasn't met so far, take the time to review these applications and reach out to these people, individually, and either a phone call, conversation, or whatever is deemed appropriate with the committee, and then come back next month with either recommendation of one individual or two or three that seem to be attractive, to be a good fit for the board, and notify the chairman and the county board that the nominating committee is going through the process, and when they're ready to make a recommendation, they'll provide that to everybody. I think we need to get that back on track. I think that's the appropriate way to do it.
I just wanted to clarify again, which I know I did say last month. I have been communicating with the county board chairman since January about the nominations. So there definitely has not been a gap in communication there. And then the forms that I had, I did forward on to the county board chairman and to Jeannie Durham, which is the board secretary. I did not have the one that you had, so I haven't done that, but I'm happy to do that first thing tomorrow. But I just wanted to make sure you all know that I have done that, have been communicating since January for this particular.
So when they go online and fill these out and they send the email, it only goes to us, it don't go to the county board level, is that right?
So if they
It don't get
just,
transferred, I'm saying.
if it goes to all of you, especially to the nominating committee, then unless you forward it to me, I don't even know about it, which is fine, because it's the nominating committee. But if I ever receive them, I do forward them on, just, as an additional courtesy to the county board or county board chairman, that I am aware that there are interested parties. So I'm happy to do that to help out, but that person can certainly forward it directly to the county board chairman as well.
But this is a generic form, right, for appointments to any boards, because it just says make county appoint request, and it's telling you to email it to Jay Durham, whoever that is.
That's Jeannie Durham. the
Okay.
board
That's
secretary.
why I thought.
So if somebody fills this out, if they don't give it back to one of us or somebody from the nominating committee, they may end up emailing this directly to them, and we may not even know about it. So we probably need to think about maybe the nominating committee. We'd have an issue with that, Mike, if we had our own form, or can we just use this form and just change how they respond back in terms of submitting this? So it comes to us instead of going to the county?
You can use that form, but it's the chairman's appointment. So if that's a form that the county board office is giving out for people who are seeking appointment from the chairman of the county board, then that's the form. You can't take that form over. Let me put it this way, you can't prevent that form from being out there and used.
But can we put the information on there where somebody got this, it could come back to a member of this board, especially the nominating committee, to where we're aware that this person's interested, because if the loop doesn't get completed, then this is going directly to the county board secretary.
I think
Then we
that,
don't know about it unless they pass that information back to us.
I think the avenue you might want to explore is asking the county board chairman to instruct the executive secretary to copy those upon receipt to the Board of Health, as opposed to directing
That
them
makes
to
sense.
first off.
So I
Okay.
thought whenever she filled this out, and she said she sent it, I assumed that they would get it, it'd go to the right place. Is that right?
Well, hopefully, I can't speak for, as far as the county receiving it. What I can say to add to what Mike said is, we have asked for, notification that if there were interested parties, to be notified so that I could notify the board. But I think it would be great if our board could speak directly to the county board chairman or to the board secretary to make that request, and then maybe there would be that full circle that Mark referenced. And I will also say, everyone that's been appointed to our board, some people never complete this. So it's also not like used 100% of the time for all people that want to be or are put on our board by the county board chairman. So if that's something that our board feels strongly that you want one of these completed, I'm sure you can't tell, the chairman that it has to be done since it's his appointment, but maybe to make that request on behalf of the board rather than it coming from me.
I like the form because it has questions on here and you're getting to see the opportunity to see the responses and learn about a little bit more who they are. So, but we got a motion and second. I'd like to take a vote on this if we need to.
I'm sorry, sir, if I could just interrupt for a moment. There's been a lot of discussion with respect to the nominating committee. How many people are currently on the nominating committee?
Three.
Okay. I wanted to make sure that you didn't have a open meetings problem in terms of a quorum, and I think 3 is one under where you would trigger an open meetings issue. Obviously, these types of meetings would generally not be conducive to an open meeting in the first place because you'd go into closed session to discuss the appointment of particular people to a public body. But I just wanted to, my alarm bells went off. I wanted to make sure they could stop.
So should we, if the nominating committee meets, or any committee meets for that matter, should we be keeping a record and minutes of that meeting, or how should that be handled?
If there are 4 of you in a room ever who are discussing Board of Health business without a 48-hour notice of public meeting, an opportunity for public comment, an agenda, listing any potential action items, then you would be in violation of the Open Meetings Act and subject to prosecution.
So that's why all the committees are made up of bodies of 3, probably.
Yeah, I can't really speak to that,
Because
that wasn't necessarily
every
done
one
on
of them, I think
advice,
it's
but
3. Isn't every committee we have right now made up of comprised of 3 people? I know the finance committee was, the
There might be
personnel
one that's
committee is.
4. I'd have to look, but
Okay,
I mean, if we're aware of a committee meeting, we do ensure that we give guidance to the Board of Health members about following Open Meetings Act. But if for some reason we weren't aware and the board was initiating that without our knowledge, then we couldn't help guide that. But I guess that's the friendly reminder of the Open Meetings Act. Make sure you get your training done and all of that, because there are a lot of intricacies to that.
Mike, could you, sounded like you were finishing your thought. So is what the health department board is doing with 3 people on each committee, is that the right thing to do?
well, you currently, I do have some concerns because right now you have 10 members of your board, which means that a quorum would be, well, I guess that doesn't change the math. If you lost one more, we'd have a problem. But you normally at full staff are 11, which means a quorum is 6, which means a quorum of a quorum would be 4. So anytime 4 of you are in a room talking about Board of Health business without going through all of the things that you have to do in advance of an open meeting, you would be in violation of the act. So if there are 3 of you, then that is not a violation of the Open Meetings Act. I don't know that I can answer your question in exactly the fashion you asked it, in terms of, is that okay, is that all right, is that the way it's supposed to be done? I'm not sure it's the way it's supposed to be done. It's simply not a violation of the act as it is written.
okay, that's good to know.
All right.
So do we need to take a vote on this then?
I'm getting ready to, the
Well, I didn't
motion
know-
that you made, is that what,
I
I'm getting
didn't know
ready to
if
do
this was
that.
gonna be like the other thing with the contract, then we would just don't leave it set. I didn't know.
Well, at this point, there has been a motion and a second,
Yeah.
Madam President, so I think it is important that.
Right, and that's what I was getting ready
Yes.
to do,
Yes, ma'am.
so. Do you have it, the motion down in the second? Okay. So, roll call vote, please.
Vivian Goodman,
Abstain.
Mark Scranton,
Yes.
Jan Hack,
No.
Andy Clevenger.
No.
Pardon?
No.
Jim Bentler,
Yes.
Debbie Hill,
Yes.
Cody Parks.
Yes.
So we'll move on to, we have 5, yes,
2 noes and an abstain, and the rest are yes.
okay.
So 5 yes.
So that's the motion carried.
How many did you say was
All
yes?
right, so
Five yes.
Maybe I want to clarify. What did you say was yes?
Should be.
Oh, excuse me, 4,
Yeah.
sorry.
Okay, that's,
4, 2, and 1.
Right.
That's what I
Okay.
know.
Right.
So motion passes.
Yeah, I said that. All right, new business. Nominating committee, presentation of slate of officers willing to serve. You guys have anything on that? Okay. We will move on to the Popeyes, well, you're not gonna present tonight?
Yeah, I talked to them this morning and they decided they would like to attend in person next month to talk to the board, so, I just thought I'd let you know that, since it's already on the agenda, we had saved a spot for them in case they wanted to join virtually, so they plan to be there.
Can you or Kathy tell us, has anything else happened? Have they reapplied? Have they asked to reapply?
Kathy and I had a meeting with them because they did end up calling, just last week. And so we did speak with them and they are interested in applying to open back up here locally. So, they asked us a few questions and we basically just told them that the process that they were requesting to speak to the board would be that they, come speak to the board and that would be, a board decision. So,
is Kathy here tonight?
she is not here tonight. Brian, her assistant director, is here tonight.
Okay, who's more familiar with the prior history of that?
Kathy is, I do
Okay.
have,
I don't want to get into
a
it
lot
real
of-
deep, but I
okay.
just kind of would like to see kind of where their minds are at, because this has already happened twice before, but it sounded like from what he told us last month, it's a different group of people. And I like what he had to say, and I like his ties to Decatur, especially. It's kind of neat, I mean, hearing him talk about the history of his family, and the building where we're at right now belonged to his family, and, that whole thing, it sounded like there's a lot of commitment there. But I really question if it's still the same organization or what parameters get established for consideration, because if they come in and do a good presentation, but it's the same group and they had 2 other opportunities to make this work, I'm not gonna be a big fan of supporting what they're wanting to do. I mean, I like to see businesses succeed.
I thought he
But,
said he fired.
That's gonna be, my big question to, get some answers to, so.
I thought he said he fired that guy.
I'm not sure, that's why I'd rather hear from Kathy's team what their experiences were, and if they feel like they're revisiting the same thing all over once again.
I do have just a few brief bullet points that she provided with me after our meeting. We did meet with someone named Nick, not with Adrian, that was here last month. Nick's down in Arkansas and he manages several locations in 4 states. Her thoughts were if they were to reopen, she would expect stipulations to be agreed upon similar to what we did with the other establishment. That adds a lot of extensive time to leadership in environmental health of having to take, all of that extra work, paperwork review, et cetera. With the other food establishment that we did allow to have a new permit, there are still numerous issues that are noticed each week in these reviews. So that is pretty time intensive. And increased inspection frequency also adds work to all of the team members in that division. It does look like from the file, it can be seen that we gave Popeyes, which is under HZ Ops, which is the same business that is asking to apply for the new permit, numerous attempts to remediate the facility prior to closure. She has concerns about this person being located out of state and whether or not they'll have time to ensure that the facility is managed appropriately. And then the Adrian Owens that was here last month, he runs several locations in the area and several of those locations are noted after reviewing those inspections to have the same issues that the Popeyes here had before they had their permit revoked.
So you guys talked to other health departments in the other counties then?
She reviewed the inspections from those locations.
So we can access somebody else's stuff in another county?
Mhm.
Oh, really?
Yes. just like our inspections are
Well, it's
online,
public
I'm not
record,
sure
so,
that they,
yeah,
yeah,
okay.
I'm not sure that
Gotcha.
they were all online, but she was able to, pretty quickly review those just to determine that there was, similarities, so. With, and then, I do have more detail for next month if you want that.
Is that something that you can share with us if we're gonna have them here next month, that we could have that kind of ahead of time, just kind of look at it? So maybe we can ask some pertinent questions and say, hey, you guys said you're gonna do this, but you got this going on over here. I'd be really interested in see what their responses are and what corrections they have made, because, yeah, I don't want more of the same. Much as I'd like to see the business open back up, we don't need that happening.
Yeah, we can definitely do
Okay,
that.
thanks.
And make sure you pass on to Kathy and her group, thanks for doing a little bit of investigative work, and that, I think that's very smart.
Yeah, I would never thought about that.
Very well thought out.
I will definitely do that.
Okay. Is there anything for closed session?
There's not, I left that as a placeholder, and then the only other thing I have before we adjourn was just a big thank you from the health department staff to Dr. Patterson, who wasn't able to be here this evening, and then, of course, our current president, Vivian Goodman, for all of your time and dedication on our board and support of public health and passion for public health. We appreciate you very much and the time you've spent with us. I know the team here at the health department voices that as well.
Well, thank you. It has been my pleasure, and I just appreciate the work that you guys are doing, and so I know that you will keep it up, and hopefully your hands won't be tied, so you can't do your job, but thank you. It's been a great opportunity. Sorry.
You've done a good job, and I applaud the.
Thank you, I appreciate it. I will, I may not be here, but I will still be, you know that I've worked with the health department for years and years, since Gary, Andrew was here, so, I'm out in the community, in the trenches. I know I work with a lot of the populations that you guys serve, and so, yeah. Which is why I was here in the first place, but I just appreciate your sentiments. So, thank you. All right, if nothing else, I'll entertain a motion to adjourn. Who first?
Oh, I'm first. I'm sorry, I'm tired.
I'll second it.
Thank you, and roll call.
Vivian Goodman,
Yes.
Mark Stratton,
Yes.
Dan Hack,
Yeah.
Kenny Clevenger, Jeff Endler,
Yes.
Debbie Hill, Cody Parks.
Yes.
All right. Thank you all. Meeting adjourned.
Thank you all.